Good morning, everyone. I'm Katie Doherty, the President and CEO of the Kennebec Valley Chamber. Thank you for joining us this morning for our third weekly Chamber Connect. Feel free to submit questions throughout the presentation in the chat box, and we will address them throughout the presentation and have a Q&A time at the end as well. We will also be recording this and putting it up on our website for future reference if you would like to share that with anybody. Today, we are joined by Eric Jermyn, the president of Cross Benefits Solution. Eric has a vast experience in health insurance and employee benefits, having worked for Anthem Blue Cross and Blue Shield of Maine for 22 years prior to joining Cross Benefits Solutions, more than 4 years ago. Eric is licensed in the state of Maine and many other states as a life and health producer. Eric has worked with employers of all sizes throughout the state, from very small to very large. Today, Eric will be covering the employee benefits and how things could be changing and affected because of COVID-19. And now I will turn the program over to Eric.
Great. Thanks, Katie. So I do have a PowerPoint presentation that I'll pull up in a minute. But before we get into that, we're obviously going to hit some areas that bump up against each other. And when it comes to employee benefits, we will frequently steer towards issues that are more Department of Labor focused. I won't be able to speak in depth on DOL issues, quite frankly, because it's not my area of expertise, and you'd really want to get some better instruction in that area. In fact, there is the Portland Chamber has an event, a web event this afternoon at 2. And Katie, if you want to share that information after the fact, maybe we could do that. That is specific on DOL issues. That said, I have attended a fair number of DOL webinars, so I do have some knowledge. So if we're able to answer questions that kind of get outside the employee benefit space, we will be sure to do that. As Katie mentioned, feel free to ask your questions in the chat room. Katie will be monitoring the chat for those questions, and then we will have time at the end for questions as well. My presentation will not go the full hour. We will have plenty of time for questions at the end. So with that, let's see. There we go. All right, the wonders of technology. I got to tell you, I've become something of a Zoom meeting expert. As I've got several of my team are on the meeting today, and they will attest to my Zoom meeting excellence. So needless to say, COVID-19 hit us quickly, unexpectedly, and it has forced the carriers, employers, regulators to act very, very quickly with somewhat limited information. So first and foremost, I want to talk about coverage issues related to COVID-19. And for some reason, there we go. So I want to talk about coverage issues related to COVID-19. They're actually fairly simple. Initially, carriers and states moved pretty quickly, really in the month of March. It was really mid-March. California was the first state to come out and mandate that COVID-19 testing had to be covered in full by insurers with no member cost shares. Of course, it does have to be physician approved. Now, this is a really important caveat to everything we're discussing. Just because you have coverage for COVID-19 testing and treatment does not mean that you will necessarily receive it. You need to have a doctor sign off that you are a candidate for testing. And as we have seen, and I'm sure that you've heard plenty of stories from individuals throughout the state and throughout the country, that not everyone qualifies for testing. So just because you have the coverage doesn't mean that mandates that you will receive the testing. But California first came out and said testing would be covered with no cost shares, and then quickly followed, I think the next day, I think it was March 12th for California and March 13th for Oregon, to say testing had to be covered with no cost shares at the member level. Maine's carrier, so in Maine, Cigna moved fairly quickly, but also Harvard Pilgrim and CHO came out rather quickly to say that they would be covering testing in full. Ultimately, and we'll talk a little bit about the Bureau of Insurance, but ultimately the Bureau mandated it. Additionally, since the testing decision was made, carriers have moved to cover treatment of COVID-19 in full with no member cost share. Cigna was actually the first carrier to announce it. They announced it on a national level, quickly followed by other carriers. In fact, the state did not have to go so far as to mandate coverage with no member cost shares because all the carriers did it on their own. Now let's be realistic. This is not necessarily because, out of the goodness of their heart. This is a business that they run. The reality is that claims levels right now for health insurers are exceptionally low because if you think about it, no one's receiving largely, and with the exception of certain cancer treatments and whatnot, and emergency treatments, no one's receiving elective treatment. So claims volumes for the insurers are actually quite low. So making the decision to cover COVID-19 in full with no member cost shares was a fairly easy financial decision for them to make. So they get some goodwill out of it, and it also happens to be good for your members and their family members. On the self-funded side, and this is really important, on the self-funded side, the employer must choose whether or not to cover COVID-19 testing and treatment in full. Self-funded plans are not regulated by the state's Bureau of Insurance. They are regulated at a federal level. So if a self-funded employer wants to cover those items in full with no member cost shares, they need to inform their third-party administrator or their carrier. This also applies to small group self-funded, and I'm sure that we've got some folks on the call who have these plans. Aetna Funding Advantage is a level-funded small group self-funded plan. You need to opt into this coverage if you want it. Anthem Balance Funding, United Healthcare has a plan as well, as does Harvard Pilgrim. So if you are on one of these level-funded plans, you need to be sure to opt in to make sure that coverage is covered in full with no member cost shares. And if you don't know what type of plan you have, be sure to reach out to your broker to find out. So again, getting back to the CDC, they ultimately determine who qualifies for testing. So just because you have coverage doesn't mean you can demand testing, okay? Now, one thing that is really starting to heat up is return to work testing. I can tell you that many large employers, I can tell you Google, Amazon are now starting to build testing facilities at their workplaces so that they can test employees before they allow them to return to work. Now, as of right now, we don't have the capacity in the country to handle that. So there's more to come on that. Also, there's going to be discussions over how that's going to ultimately be covered, who will be on the hook for that testing as it pertains specifically to return to work. So more to come on that, and I would urge you to keep an eye. I know the Wall Street Journal had an article on Monday, actually a very expansive article on this on Monday. So if you want to learn a little bit more about return to work testing, you may want to check that article out. So I mentioned the Bureau of Insurance, and I can tell you that Eric Chapa, he's the Superintendent of Insurance, and he has been absolutely outstanding throughout this pandemic. He's in a very challenging position. He has the responsibility of protecting the consumer while also maintaining the viability of the insurance market. Not an easy position, especially in a situation like this, where things are changing really, really rapidly. But I can tell you, I've been in very regular contact with Superintendent Chapa, and he has been really fantastic. He has the insurance market, the insurance consumer, and the employer at the top of his mind as he's making these decisions. So March 12th, Governor Mills issued a proclamation of an insurance emergency. Basically, what this proclamation of insurance emergency declares, it allows Superintendent Chapa much more authority and flexibility in terms of directing the market. And he has used it. First, he issued, again, in conjunction with the issuing of the insurance emergency, Superintendent Chapa issued Bulletin 442, titled Emergency Measures Responding to the Coronavirus Pandemic. In that order, he did in fact mandate the first dollar coverage for approved testing. He also mandated first dollar coverage for immunization once developed. The key words, of course, in that sentence being once developed. Also reminded carriers of laws regarding emergency care. Under Maine law, if you are seeking emergency care, you do not have to worry about whether you are getting it from an in-network or out-of-network hospital. If you deem it an emergency and you seek that care has to be paid at the in-network level. And in his bulletin, Superintendent Chapa reminded the carriers of that. He also reminded carriers of the need for flexibility with network utilization. And his thinking behind this was, if a certain hospital or hospital system became overwhelmed due to COVID-19 and had to direct patients to other hospitals that perhaps were not in a carrier's network, they were asking the carriers to be flexible in terms of covering those services at an in-network level. Also in the bulletin, he strongly promoted the use of telehealth services. He actually later expanded upon that guidance and essentially said to the carriers, listen, if your office visit copay is $20, your telehealth services visit should also be $20. He didn't want the care delivered through telehealth or phone video health to be different than in person. I will tell you that early on, telehealth services were overwhelmed. It was not unusual to see wait times for telehealth or digital health services at 2.5, 3 hours. That has drastically decreased as folks have become more aware of what the symptoms of COVID-19 are, what their level of risk is. So telehealth, I will tell you, it is a very, very useful service. My family has used it on several occasions. It's incredibly convenient, but it's also, frankly, safe. If you don't want to put yourself in a situation where you're going into a medical provider, you can sit at home and do a digital or telehealth session. The bulletin also ordered carriers to assure access to prescription drugs. So essentially, if certain formulary changes happened due to changes in the availability of certain prescription drugs, basically the Bureau was directing the carriers to say, hey, if a generic isn't available and the only thing that's available is a brand name drug, be sure that you're going to charge at the generic level. So asking for flexibility there. Another area they asked for flexibility in is the area of utilization review. Utilization and review, a simple example would be, you do something to your knee, your doctor says that you need an MRI. Typically now in our market, we need to make a phone call to our carrier to say, hey, my doctor says I need an MRI. Then you go through an approval process. The Bureau has asked the carriers, and I can tell you all of the carriers have told us very early on that they were backing off their utilization review requirements. So you're going to see far fewer utilization review requests during this pandemic. And lastly, and almost unnecessarily, but directed the carriers to provide timely and accurate information regarding COVID-19. I will tell you, many of the carriers have done a very, very good job, whether it's through webinars, through emails, through their websites, through their mobile apps. They've done a really good job of communicating information regarding COVID-19. Subsequent to Bulletin 442 on March 12th, Superintendent Chapa issued a supplemental order regarding continuation of group health coverage, and that was, again, March 27th. And he directs carriers to allow employers to forego eligibility rules for furloughed employees. So those of you who own businesses know that you typically set your hours of eligibility, and under the ACA, you have to set it at 30 or lower. Under this supplemental order, if your employees are not working those 30 hours because they're furloughed, you can keep them on the health plan. Essentially, and I will tell you, the carriers came out very, very early, and I will say all of the carriers came out very well. Some came out later than others. Essentially, the more local or regional carriers were very quick to announce this, and the national carriers, just because of their size, took a little longer to make these announcements. But they basically said, as long as you keep paying your bill, you can keep your employees on their insurance. Now, a couple of them set a couple months, others said 6 months, but for the immediate future, and when I say immediate future, I'm talking May and June, if you keep paying your health insurance bill, you can keep your employees on the plan, okay? Now, that's a pretty broad statement. I can tell you that many of our group customers are doing their absolute best to keep their employees insured. It's scary enough to be furloughed during a situation like this. It's scarier still to be furloughed with no health insurance when you've got a pandemic that's keeping you home. So many of our employers are doing their absolute best to keep people covered. But we will talk a little bit more about other options that are available. There was also on April 6th a supplemental order regarding the deferral of premium deadlines. On April 6th, the order was issued, and it directs carriers to forego the cancellation of groups or individuals for non-payment of premiums. And there's some retroactivity to it. So if groups didn't pay their March premium and canceled in April, they can actually request to go back and reinstate their coverage. Now, here's what I'll say about this. If you are an employer and you are able to pay your premium, I recommend you pay your premium. If because of cash flow issues resulting from COVID-19, you absolutely cannot afford to pay your premium, you can defer it. The reality, however, is you will have to pay it back. So if you are unable to pay your May premium, you're going to have to pay it at a later date. Now, what I can't tell you, because we haven't been told yet, is how you're going to have to pay that premium back. I can tell you that in my conversations with many of the carriers, the idea has been floated that, you know, if you forego paying your May premium, they will give you some time to pay that back. There won't be an expectation that you suddenly double up on your premium in 1 month. Now, the reality is they could request that, but most employers would have difficulty doing that. So I would actually anticipate seeing something along the lines of, 3 months, or perhaps even you could spread the amount that you owe over the remainder of your plan year. So if you were a January 1 effective date, you would have, the months July, August, et cetera, to pay off that remaining amount. I can tell you that I've seen some pretty creative things that employers are doing, trying to keep their employees' health insurance in place. I don't know if you saw the piece, David's restaurant down in Portland. He has a pretty large supply of draft beer that he is sitting on while his restaurant is closed. And in an effort to raise money to help pay his health insurance premium, he's selling that beer, and people can pick it up in quart amounts. So so I can speak apparently for David sees the value of maintaining his employees' health coverage, and I think most employers see that value. The carriers are going to be flexible with us. Again, let's be realistic. They are seeing drastically reduced health insurance claims during this period. So that lack of claims leads to some liquidity that they can use to help employers to defer some premium. I have gotten some questions about where things are going to go after this. Well, you can fully expect that there will be a pent-up demand for elective surgeries, diagnostics, etc. I was actually supposed to have an elective diagnostic 2 days ago. I won't tell you what it is, but I'm coming up on my 50th birthday, so you figure it out. But I was supposed to have that on Monday. That obviously has to be rescheduled. So we are going to see a pent-up demand for services. So we do expect to see an increase to claims. When that will happen, we don't know, because frankly, we don't know when we're going to return to normal or whatever the new normal will be. I've been on several calls with leadership from various carriers. I've not heard anyone say that they expect to see a large increase to health insurance trend. Health insurance trend is essentially health insurance inflation, okay? And it's what actuaries use to predict what claims will be in the future. It's what underwriters use to predict what rates will be in the future. It's a combination of price increases and utilization increases. So those two things combine to give us healthcare trend. And the numbers that I'm still hearing are between 7% and 10%. Now, that doesn't necessarily equate to average rate of increase at the employer level. Lots of other things factor into that. But health insurance trend, I'm hearing, is still being pegged at 7 to 10%, which is not an increase over where we are today. So that was the action that the Bureau of Insurance took. Now, I mentioned how there are many employers who are doing everything within their power to maintain coverage for their employees. But the reality is that employers that are severely impacted by COVID-19, if they are trying to maintain their group health insurance plan, the reality is they can probably only do that for a certain amount of time. And at some point, there will likely have to be layoffs and terminations from the group health plan. When that happens, there are lots of options for employees, okay? And I'm going to go through what these options are, but I will tell you, I have a team of people who specialize in these non-group health insurance options, that if you find that you as an employer are in this situation, you can reach out to us. You can also reach out to your current broker. They do this as well. There are lots and lots of options. I don't want people to think that they are, they're left with no alternatives if their employer it drops them from their health plan. First is COBRA. So many people are familiar with COBRA. This is the federal law that applies to employers with 20 or more employees, that allows an employee, if they leave coverage, it allows them to maintain their coverage at their own cost. So essentially, you take the group coverage you had, you keep it in place, you pay the bill, and it amounts to 102% of whatever the cost was for the total employer cost, employer and employee. So it's basically, there's a 2% admin fee that's built into that. So obviously a drawback is it's expensive. COBRA is typically expensive. Additionally, there are limited plan designs. So if your employer only offered 1, 2, 3 plan designs and one carrier, you are limited to that one carrier and that 1, 2, or 3 plan designs. And in addition, there's an 18-month duration in most cases. Now, there's some other cases where it can be extended beyond 18 months, but we should really just, for the purposes of this discussion, we'll focus on 18 months. So COBRA is not a great alternative. Now, I will say there are some ways to, I don't want to say game the COBRA system, but essentially that's what it is. You've got 90 days to elect COBRA. And if you elect COBRA, you go back to the date that you became eligible for COBRA. Now you do have to pay your back premium. So you do have a little bit of a window. So if you do happen to get laid off from your current employer or drop from the health plan and you can find another job, which, let's be realistic, is going to be difficult in this market. But if you can find another job that has health coverage within 90 days, you'll be able to go and go without having a major disruption to your coverage. The next option is for employers with, or employees of companies with fewer than 20 employees. And that is Maine's mini COBRA. Same terms as federal COBRA in terms of cost. It's 102%. Same limited plan design. So if you only offer Harvard Pilgrim, you can only choose Harvard Pilgrim. And if you only offer 1 or 2 plans, you can only choose one of those 2 plans. Or Anthem or CHO or whoever it is you happen to have. Eligibility rules do apply. You have to work at an employer for a certain amount of time. I believe that is 6 months in order to qualify for mini COBRA. The duration is a little different than federal COBRA. It's a 1-year duration, so 12 months. Getting away from COBRA and into more affordable territory is individual plans, both on exchange, federal exchange plans, and off exchange plans. We have 3 carriers in the state that operate in this space: Anthem, Community Health Options, and Harvard Pilgrim. And they both operate in the on exchange and off exchange platforms. On exchange, so you got the 3 carriers, a very wide selection of plan designs, and you have the potential, based on your estimated earnings in 2020, you have the potential to earn subsidy, which means the federal government may pay a portion of your premium. Now, the way you learn that is by talking to either talking to your broker or talking to someone on my team who can help you figure out. Now, it is going to be difficult for people to estimate their earnings. Earnings include not only what they made while employed with you, it would also include any unemployment benefits that they receive. So it's basically any taxable income would go to your earnings. So we can help you figure out if you're going to qualify for a subsidy. If you don't qualify for a subsidy, it's easy. You just buy your coverage off exchange. Rates in the individual market are based on age and geography. So the rates for a 40-year-old person in Kennebec County are going to be different from the rates for a 40-year-old person in Aroostook County. That's because the cost of care in those areas is very, very different based on the state. So it is age banded, and those age bands are 1-year age bands. So you're going to see a pretty wide disparity when it comes to rates for individual coverage on and off exchange. Now, hopefully, if you qualify on exchange, you get the subsidy, and that helps to offset your costs. So what about other coverages? We've actually gotten a lot of really interesting questions about ancillary coverages. So things like dental, disability, life insurance, vision, etc. So we'll start with dental. Many carriers have come out very quickly. Emeritus, Delta, others have come out very quickly and said, I think Anthem Dental as well, have come out and said, listen, for the next several months, any renewals that come up, no increases to the rates. Now, again, I worked on the carrier side, so I feel like I can speak pretty well from this area. Is there some good PR to this? Absolutely. makes them look nice. They're not given any increases. But think about dental insurance right now. Absolutely no one is receiving dental cleanings because the only services that dentists are allowed to render right now are emergency services. And I can tell you, I have several dentist friends, they're not working very much. So the dental carriers are seeing a drastic drop in claims. If we think the health insurance claims are low, dental insurance claims are lower. So yes, it's great and it's wonderful that the dental carriers are giving no change renewals. Makes it very, very easy for the employer to say, yep, let's put that one to bed, get it off my plate. Dental is renewed for the year, sign the renewal sheet, move on. And it's obviously helpful for members, but it'll be interesting to see what the long-term impact to dental insurance is, because we all know that dentists are in high demand. There is going to be a glut of people needing dental care once this thing ends. And I can tell you, I'm not expecting that I'll be able to get in very quickly for my next cleaning. And especially those who have had to forego cleanings during this pandemic, they're going to have trouble getting on their dentist calendar. So I actually expect that you'll see dentists starting to do things like Saturday hours, et cetera, so that we can get through the glut. But it'll be very interesting to see how that all works itself out. Let's see. Also, we are seeing relaxing of eligibility rules, just like on the health carrier side. We, by and large, our dental carrier partners have said to us, listen, if they keep paying the bill, we'll keep their people covered, much like the health insurance. And again, it's for several months out. And some of our ancillary carrier partners, especially those that are aligned with medical carriers, with health insurance carriers, they're allowing some flexibility in terms of premium payment as well. So if you are having trouble paying your bill for ancillary coverages, I strongly, strongly, strongly urge you to reach out to your broker and ask what kind of flexibility you can have in terms of getting your bill paid for the next month or two. Going back to the health insurance piece, the Bureau of Insurance said you can't cancel anyone for non-payment until June 1st. Several of the ancillary carriers are following suit. That includes disability. So on the disability side, you have the issue of people could be filing disability claims related to COVID-19. Now, here's what I would suggest. If you have employees who test positive for COVID-19, I would submit the disability claim just as you would any other short-term disability claim. You do have an elimination period. Typically, 8 days is pretty typical. They'll have to meet that elimination period before their coverage kicks in. But there's not a lot of special treatment being given to COVID-19, so it will be handled much like other claims or any other medical condition. Again, virtually all of our carrier partners are offering no change renewals, just saying, hey, sign here and we'll move it on down the road. Some for as long as 2 years, so 2-year guarantees. So there's lots of flexibility in terms of renewals. Also flexibility again in terms of premium. The insurance carriers are saying, hey, we understand that you're in a tough spot. Let's help you figure out how to work through this. And that applies to vision carriers, life carriers. Again, vision, you can't get a new pair of glasses right now. You can't go see your optometrist. So the vision carriers are going to have virtually no claims. So yes, it's great, but there's a financial reality to why they're doing it. I also want to point out some opportunities for you. The proliferation of scams under COVID-19 have been drastic. And I will tell you, they are incredibly creative. You know, I've talked to a friend of mine is the owner of a large company, and they had a ransomware attack. It is, and it was, you know, has to do with people working from home. You're suddenly, you know, you're a little less vigilant than maybe you are at work, and you click on the wrong email. Suddenly, you've exposed yourself to a problem. There are identity theft carriers. We have an identity theft carrier called InfoArmor. They are one of the preeminent identity theft protection companies in the world. And they've basically made an offer to us that our clients can have free coverage for identity theft for the remainder of 2020, as long as they commit to offering the benefit as a voluntary benefit, so it's paid for by the employee, starting in January of 2021. So, you know, during this really unprecedented time, you can give your employees this identity theft coverage, and then when hopefully this pandemic is blown over by then, and then in 2021 they can make a decision on their own whether they want to pay for it. So if you want to know a little bit more about that, you can feel free to contact me, and I can put you in touch with someone on my team. So I know that we moved through that fairly quickly. Actually, just about, I figured 40 minutes, and we're looking at about 35, so that's not bad at all. So why don't we open it up to questions?
Perfect. So we have a couple questions in the chat box. What are the verification requirements for the national paid leave under the CARES Act?
So again, these are issues that are more DOL related than they are employee benefits related. And I would recommend that you contact the DOL or a labor attorney for the specifics on that. Now, that said, if you wish to email me after this session's over, we've developed a really expansive resource document that I can share with you. We've developed it for our customers, but if you'd like to receive it after the fact, I can share it with you. And it has all of the specific language related to that, those issues. But I'm not an attorney, and I wouldn't want to give legal advice.
Another question is referring to testing. Can employees require a doctor's note for return to work?
Great question. That is, at this point, unknown. That's why I think it's actually, I think you're going to see more and more employers go the route of show me a negative test. Once the testing becomes more available, we get into, and I will tell you, I've had these same conversations with my own HR folks because you're getting into areas of health information, personal health information that what rights do you as an employer have? I can't ask about other health conditions. Now, this is a different situation because we are talking about a pandemic, and we're talking about an easily transmittable issue. So I think there's going to be more direction on this. Hopefully, we have to deal with this relatively soon. I know I'd like to see the economy getting up and running when it is safe. I want to be clear about that. And I'm not doing any political conversations here. This is purely a what to do about your employee benefits discussion. But it's uncertain as of yet whether you can require a doctor's note before return to work.
So an observation that Stacey Morrison made from Guinnesston Construction said, since paid leave is reimbursable and there is no testing in our area, we made the decision to ask employees that were sick with any flu-like symptoms to stay home. We only had 1 of 32 abuse it, which we do not require any documentation. So that's an example.
Yeah, we've done something similar. Basically, if you're exhibiting flu-like symptoms, we've asked them to quarantine for 14 days. Now, we were very lucky. We moved, and obviously, Stacy, you can't do this. We moved to fully remote. We are 100% remote, so our entire team is up and running. I actually came into the office today so I could have this cool sign behind me that I forgot would show up backwards on a Zoom meeting. But you can see our logo, which is nice. But you know, we've been lucky that we've been able to do that. Many employers can't. So I know that many employers have gotten to the point of, listen, if you're exhibiting flu-like symptoms, quarantine for 14 days, and then return to work.
Another question is, do the Maine Bureau of Insurance rules apply to Maine employees where the group coverage status is outside of Maine? We are headquartered in New York State, where the group policy originated from.
Yeah, so yes and no. Certain aspects of Maine law do apply. Well, there's a couple caveats to that, and feel free to answer on the chat. And I'm not reading the chat, Katie, so if they answer, you've got to tell me.
Okay.
Are you a remote employee of that New York-based company, or are there bricks and mortar? Is there a building here in Maine?
Building in Maine.
Okay, so most state law would in fact apply. I will tell you that New York has been on the cutting edge of consumer-friendly rulemaking. So I find it, I would find it very hard to believe if Maine were being more aggressive than New York. So I would feel comfortable. But again, I will tell you this, we have customers in New York. So this resource document that we've developed includes some information about New York. So after the fact, I can get that to you.
Perfect. Any other questions? I'm not seeing any new ones in the chat. I will mention too, Maine General recently did send out an email stating that employers requesting, return to work clarification from Maine General. Maine General is only testing the severe cases. So please don't go to Maine General and ask them, your employees, to get a testing to be cleared back to work, because they're not going to get it, and CDC is not going to test it unless they're severe.
Yeah, this is really going to become an issue, Katie. I can just, here I am, I'm sitting in our office, and I think I'm one of 3 people in the office. And trust me, we're not even near 6 feet from each other. We're 50 feet from each other. But, and I've got the door closed. I will tell you this, normally this office holds 40 people. I would be extraordinarily uncomfortable asking those 40 people to come back until I had widespread testing to ensure that I wasn't going to have my employees getting infected here in the office, because the reality is there will be workers' comp issues arising from this if an employee is infected at work, especially if they work at a healthcare provider. That's an obvious workers' comp issue.
Yeah. So I did post the link to register for the Portland Chamber's free webinar this afternoon at 2. If you do have questions more related to Department of Labor, Laura is doing a presentation there. So that's in the chat box. Feel free to join that if you'd like to. Any other questions this morning? I don't see any. Eric, you just did a standout job.
I doubt that very much. But just to jump off what Katie said, I can't urge you strongly enough to attend the webinar at 2. The DOL, I got to tell you, my interactions have largely been with Superintendent Chapa and the Department of Labor. And I have been really, really impressed with the work they've done in unprecedented situation. We're very lucky to have people like Laura and Eric in state government, honestly, as regulators.
Perfect. So reach out to the chamber just at info@kennebecvalleychamber.com if you would like any of that information sheet that Eric was talking about, and we can make sure we get that to you. We'll also be emailing out the recorded version of this to all the attendees today and posting it on our Facebook, so feel free
Yeah,
to.
and Katie, here's
Yeah.
here's my contact information with
Perfect.
my email address and my cell phone number.
Perfect. So note that, and we will include that in the information as well. So thank you, Eric. Any closing remarks from you before I close it out?
Nope. Thanks, everyone.
All right. Our next Chamber Connect is next Wednesday, April 29th. So please join us then again at 10 a.m. Check our website for information, resources. If you need help, please reach out to the Chamber at this time. We're here for you. Thanks again for joining us this morning, and everybody have a great day.